Hello and welcome everyone. I'm delighted to see such a huge range of countries represented. I'm Karen Momber and I'm the publisher for Professional Learning and Development at Cambridge University Press. And I'm delighted to introduce our speaker for this session, Dr. Kate Brierton. Kate is a chartered clinical psychologist. She completed her first degree at Cambridge University and then studied at the Institute of Psychiatry, Psychology and Neuroscience in London. Kate currently runs her own clinical practice where she uses compassion-focused therapy and mindfulness in her work. Outside of her clinic, Kate has played a key role in creating a compassionate school culture at a secondary school near Cambridge. She presents and blogs on compassion and wellbeing in education and is currently co-authoring a book on the topic. Today, Kate is going to talk about supporting emotional wellbeing and empowering learners in the post-lockdown classroom. There will be an opportunity for questions at the end of the talk, so please write any questions for Kate in the Q&A box. Thank you, and over to you, Kate.
Thank you very much, Karen. That's great. And I'm delighted to be here talking to everyone across the world again. Let me just see, I'm going to see whether I can share my slides. I need permission, please, to share my slides. From the moderator. Just waiting. Brilliant. Thank you very much. So I just had a quick peek in the chat box and I see that we've got people from across the world, which is so exciting. And I just want to thank Cambridge University Press and Cambridge Assessment for inviting me to talk today. We've got a big topic today and I've got half an hour to take you through it. So we're going to go quite fast. As Karen says, I'm hoping there'll be time for questions at the end. So please do pop any questions you have in the chat box and we'll try and get through as many of those as possible. But for now, I'm just going to get on in there and dive into the talk. So first of all, the emotional impact of COVID-19, the global pandemic on children and young people. What can we expect? And I've had a look at the literature that's come out so far. So there have been some studies. The academics have been very good at writing up their papers and getting things published quickly so that we have evidence for coming back into the classrooms and for working with young people. And also we can draw on evidence from previous epidemics and previous natural disasters and how they have affected children and young people. And so what you find when you look at the literature, both new and from previous natural disasters, is quite a mixed picture actually. So there are definite reports that rates of self-harm have increased during lockdown in some countries quite dramatically. There was a big study that was done in China and over half of Chinese students surveyed said that they felt the COVID pandemic had really severely affected their mental health. And there's been several different studies and surveys of what the students are reporting, what they're worrying about. And interestingly, they're worrying about catching COVID-19, even though the science actually suggests that they're fairly safe from the physical effects of COVID. They're still worried about that. They're worried about their family and their friends becoming ill. They're worried about missing school, worried about gaps in their education, and they're also feeling incredibly uncertain about their future and about how this pandemic is going to continue to affect them as their life progresses. But interestingly, there was a study that came out in the UK quite recently, the last few weeks, that showed that for some young people, actually rates of anxiety and depression have gone down from pre-COVID levels. So this was a sample of about 1,000 13 and 14-year-olds in the UK, and the study started last year. They looked at rates of anxiety and depression in October 2019. So that was before there was any sign of COVID in the UK. And they found when they resurveyed these young people in May, so that was just at the point where the really severe lockdown restrictions in the UK were starting to be eased and started to be lifted. they actually showed decreased levels of anxiety and depression. And I think that's really interesting. And it's also very consistent with what I'm finding in my own individual clinic and my work with both young people and with adults, is that how the last few months have affected us varies hugely. And it varies according to the experience you've had. And that's where the word sensitivity comes from in the title to my talk, that I think your key role as teachers in the classroom is to be sensitive to each individual student in front of you, and to know that some students may have had an incredibly difficult time over the past few months, but actually some students might have thrived and might have had some very positive experiences, and that this is okay. So young people look to the adults around them to help them interpret and make meaning of events that have been going on in the world. And we have to be quite careful that we're not propagating a sort of doom and gloom narrative with the students, and that we let them know that actually if they're feeling okay, if they've had positive experiences, then it's okay to be okay. However, there is a significant number of students that are going to be returning to your classrooms who will have had very difficult experiences, and we have to acknowledge that. So the rest of my talk is really going to focus on this most vulnerable group and how you can emotionally support this most vulnerable group. But obviously all of these tips and strategies and all of this information is actually useful for all of your students. So the first thing to do is to be aware of the risk factors that can put individual students at risk of suffering from distress and mental health problems as a result of the COVID pandemic. So let's have a look at that now. The research is definitely suggesting, and again, it's not surprising, that young people who had pre-existing mental health conditions prior to the pandemic have continued to suffer. Excuse me. And so they are definitely at risk, and it's definitely worth following those students up. Other groups of students that have been at risk include those who are physically ill too, and students that have physical disabilities. They are also at risk. Very sadly, there have been quite a lot of reports now from many different countries across the world that family conflict increased during the pandemic, particularly during the most severe levels of lockdown and quarantine. And in particular, domestic violence, those rates increased quite dramatically in some countries. And so there will be young people that have been exposed to conflict, exposed to domestic violence. And along with that, it's highly likely that the rates of abuse in families against children and young people have also increased. And of course, that is a big risk factor to developing distress and developing problems with mental health. Another risk factor is young people that have come from families from lower socioeconomic status. Clearly, the financial effects of COVID will place particular stress and strain on these families, and they tend to have fewer coping resources too. And then lastly, the young people who've experienced a bereavement during the past few months may be particularly affected. And that's a bereavement either directly due to COVID or actually a bereavement for any other reason. And that's because a lot of the restrictions that were put in place for the pandemic actually affected the way that we grieve. And even before that person's death, for example, young people were not allowed to visit people in hospital if they were terminally ill. All of that affects the bereavement process, the grieving process, and can complicate it. And in addition to that, it's also useful to be aware that many of your students, or at least a significant number, may have been separated from their caregivers during lockdown, during quarantine. particularly, for example, if one of their caregivers was working in healthcare. A lot of healthcare workers were actually living separately to their families to protect their families from the effects of COVID. But that had the result that young people haven't had their usual sources of social and emotional support around them. And again, that's a risk factor for them for developing psychological distress or any kind of mental health condition. So those are the risk factors to look out for. When you've actually got the young people back in your classroom, what are the signs of emotional distress and trauma that you can look out for too? Let's start with the older group. Let's start with older children, I would say from sort of 9 and 10 years old through to your teenagers and then into early adulthood. So, signs of psychological distress. You're looking for any changes, significant changes from how that young person was prior to the pandemic. And these changes can go either way. So you may have a young person who was quite confident and quite extrovert in the classroom, who is now actually quite withdrawn and unusually quiet, and perhaps spending a lot of time on their own and not really spending time with their friends and their peer group. Or you may have the opposite. Actually, a lot of young people, when they're distressed, will act out. So they may become more challenging in the classroom. They may start to shout. They may throw things around the classroom. They may challenge you. They may slam the door. That is equally as much a sign of distress as the child becoming withdrawn. So that's important to know, that it can kind of affect young people's behaviour both ways. Any sign of emotional lability and reactivity. So a young person who's obviously experiencing intense reactions or intense emotions that are changing quite frequently from the morning to the afternoon or from day to day. Again, that suggests an underlying problem. Changes in eating patterns and weight, and again, they can go either way. So a young person who's distressed might undereat or they might overeat. Increases in tiredness and fatigue, self-harm. So again, we know that rates of self-harm have definitely increased, particularly in lockdown, and self-harm is a way that young people use to help them regulate those really intense emotions. So look out for marks on the skin that shouldn't really be there. Also look out for clothing that might be covering those marks. So perhaps the clothing seems inappropriate somehow. Maybe they're wearing a long sleeve sweater when it's actually really warm in your classroom. There could be a chance that that young person is covering up marks from self-harming. And finally, any kind of substance use. Just like adults, young people will turn to substances to help them regulate really strong emotions. So any kind of substance use, just be aware that there's highly likely to be an underlying problem there. So younger children are quite different. And it's not always easy to tell, actually, when a younger child is psychologically distressed. They often can't verbally report how they're feeling, and they don't necessarily display distress in the same kinds of ways as older children and adults do. So the things that you're looking for is any kind of regression in behaviour. Oops, sorry, I've just gone forward on my slides there. Any kind of regression, so any changes in toileting. They're likely to have become quite clingy to familiar adults. Maybe they like to be with you in the classroom all the time. Maybe they become upset when you leave the classroom. They might be nervous in new situations or with new people. There was a large survey done of Chinese parents a couple of months ago. And this survey asked Chinese parents how the pandemic seemed to have affected their children. And one of the things that the parents said about the younger children was that the younger children seemed to be easily distracted and really struggling with focus, and that they also seemed to be really irritable too. So those are two things you might notice in this younger age group. And the other thing is that younger children tend to display psychological distress as bodily symptoms. So if a young child is feeling anxious, actually they might have a headache. They might say that they have a stomach pain, but often the actual underlying cause is not a physical illness, but a psychological issue like stress, like anxiety. So that's something to look for. And if in doubt, ask. I am hoping that schools and colleges, educational institutions will try to survey their students on return to the classroom just to gauge how they are. You know, how is their well-being? And that would be great if the pastoral teams could do that. But for you as an individual classroom teacher, don't be afraid to start that conversation. Don't be afraid to talk to the young person about how they're feeling, about how they've been. Young people find it much easier to talk about their mental health if an adult has actually begun the conversation for them. If the child is younger, then please do ask the family. Have they noticed any changes in behaviour? How do they think their child has been coping? And the other thing that you can do is start a conversation with your colleagues too. If you're particularly concerned about a student, maybe do mention it to your other colleagues and ask them what they think and what they've noticed. So don't be afraid to start those conversations. When to refer for specialist support. I'm hoping that at least some of you will have specialist support services like school counsellors or like a pastoral team who are trained in how to emotionally support students. I'm hoping that some of you will have access to those sorts of services. So when should you refer? Any kind of suicidal thoughts or ideation, please do refer straight away. Any kind of severe levels of self-harm, again, refer straight away. And you're looking for issues that are interfering with engagement in your classroom, things that are getting in the way of that student actually attending school or college, really anything that's interfering significantly with their daily functioning. And normally I say, you know, if these changes have lasted for about 2 weeks, then refer on to specialist support. But given the amount of change and everything that's happened over the past few months, I think it is going to take students a bit longer to settle back into the classroom. In addition to that, your classroom may look quite different given the safety measures you may have had to put in place. So the desks might be more socially distanced. People might be wearing a mask, a face mask or a face covering in the school. And so that all feels and looks quite different to the young people. So I would give young people a little more time to settle. I would say if the changes have lasted more than about 4 weeks, then do refer on to your specialist support. The only caveat to that is if there is those significant risk factors we mentioned earlier on the previous slide, if they are present and you are seeing these changes, I would refer that young person sooner because it's highly likely that they are in a state of distress. So I truly believe this. I think relationships are going to be the foundation of the recovery of your students. Relationships are so important for emotional well-being. We are a social species and we need supportive relationships as much as we need oxygen. And so the teacher-student relationship has never been more important. And I would encourage you to try to spend time building relationships with your students when they first come back into the classroom. I know this takes time, and I know you might be quite keen to catch up on the gaps in learning, the gaps in tuition that have happened over the past few months. But students who are feeling safe, students who are feeling secure and supported will catch up much quicker. So just spend some time focusing on those relationships. And how can you do that? So just as I think relationships are going to be the foundation of this recovery, communication is the foundation of all relationships. So communicate, really. The research shows, and I think in a way this is probably quite intuitive, but it's also quite nice to have some research behind it. When you're building relationships, face-to-face contact is by far the most supportive way of communicating with your students. But the research also suggests that video calls are better than phone calls, and that phone calls are better than individual messages, and that individually sort of tailored messages for that individual student, they are much better at relationship building than group emails. And actually, the small number of studies that have been done show that group emails don't really build relationships that well. So I would say to you, it is worth trying to make contact and communicate with your students using one of these methods. And it doesn't have to be really in depth. Just a short 5-minute phone call could make a massive difference to a student and how they're feeling about themselves. Listening. Listening is the most underrated intervention there is, I think. You will have young people in your classroom who have had very difficult experiences over the past few months, and perhaps are continuing to face really difficult life circumstances, and you're not going to be able to solve everything for this young person, even though you may want to, but you can still support them. And just listening, just taking a few minutes to listen to that student can be incredibly supportive. And again, I think it's really worth it, because if they feel listened and they feel validated, they are going to be able to settle back into school and continue with their education much more successfully. I know what COVID has had, there have been many tragedies. It has been a very difficult time for a lot of people, but it's also presented us with opportunities to rethink the way that we live and to rethink the way that we educate. And for me, for schools and colleges, I'm really trying to encourage people to think about the relationships they have with families. And again, if you could just take some time to think about whether you could start to build relationships with your student families, particularly if you're working with younger students, I think that would really help with that student's recovery. And the thing that we've all missed over the past few months, particularly during lockdown and quarantine, when we were separated from our friends and family, separated from our schools, from our workplaces, we've all missed out on that vital sense of belonging. And a sense of belonging is key to positive well-being. So when you get them back in the classroom again, focus on building that sense of community and sense of belonging. And you might be able to do that through various shared activities. But a really easy way to do it is to think about the language that you're using. And using the word we really helps. So you can say, it's so nice that we're all back here together again. We are going to get through the next few months together. We are all going to support each other. And just through those words and through that language, you can start to create a sense of togetherness, which is in stark contrast to the sense of separation that we may have felt and your students may have felt over the past few months. Okay, so for your most vulnerable students, for the students who've had difficult experiences and who may have become traumatized, how can you create a trauma-sensitive classroom that is going to support those young people? Firstly, just a little brief introduction to trauma. Trauma is a sudden or unexpected event which makes an individual feel unsafe. So you can imagine that the rates of trauma have risen dramatically over the past few months during this pandemic. There are a lot of people that are feeling very unsafe. And if that feeling is extreme, that can lead to PTSD. And PTSD is when our nervous system is turned full on. So we're really in a fully threatened state. So we're hyper aroused, we're feeling jumpy, we're feeling alert all the time. Other symptoms people might have, your students might have nightmares, they might have flashbacks to traumatic events, feel like they're reliving things again. They might start to avoid situations that trigger them, and they might dissociate as well. And dissociation is worth knowing about because it looks like daydreaming on the surface, but actually it's the mind's protective strategy of just mentally removing that young person during that moment to protect themselves from what's going on. So if a child's been abused, quite often they will dissociate during the abuse, kind of mentally remove themselves. And this can reoccur if their trauma is triggered in the classroom. So if a child or a young person looks like they're daydreaming, just be aware that that might be dissociation and that might be a sign of trauma. So what can you do? How can you be trauma sensitive in your classroom? The first thing is to keep to a predictable classroom routine. Don't make any sudden changes. And if you can, let the students know what's going to happen in that lesson at the beginning of the lesson, so they know what to expect. Keep the classroom really quiet and really calm. Try to avoid any activities that are going to increase the noise in the classroom, and particularly anything that's going to make sudden loud noises, because they can be potent triggers of a traumatic reaction. Just be more aware of your body movements too. So try and slow down a little bit, because fast movements can also be triggering for a young person. Avoid leaning over a child or a young person in the classroom. Again, if a child's been abused, an adult leaning over the top of them can often be very triggering. So try to avoid that. Try and drop down to their level instead. And just be very aware, just be careful about physical touch and proximity. Approach students from the front so that they can see that you're coming, and be very aware of personal space. And not encroaching too much on personal space. It may be that you're not able to do that anyway at the moment because of physical distancing measures, but it would really help traumatize students if you gave them some space in the classroom. And just remembering back to the previous slide where we said that some students withdraw, but actually other students act out and become very challenging in response to trauma and distress. Try to avoid any power struggles with students in the classroom. In that moment of challenge, try and step back from it. Try and give that young person space. Ideally, there would be a quiet space in your school, in your college, where you could send that young person so that they could just take some time to themselves, calm down and regulate their emotions again. That would be ideal. But if not, try to give them some space in the classroom, step away, let them calm down. And if you want to speak to them about what's happened, then do that later. Do that when they've calmed down, do that when they've regulated, and do it away from the rest of the class. So there's no chance of that young person feeling shamed or humiliated for their emotional reaction. A lot of trauma reactions are completely outside of the young person's control. They may not have had any control in that moment. So it's most definitely not their fault. Okay, so moving on to how to empower your students. And again, this is going to be really key to their recovery. Students that are feeling disempowered, defeated, helpless, hopeless are going to really struggle with their mental health and their well-being. Students that are feeling empowered, feeling like they have some control and some choice, are going to be much more motivated to move forward and make progress with their studies. So empowering students is going to be really important. One way that you can do that is to support their emotional processing in the classroom. And this is actually really quite simple stuff, but so important and so helpful for young people. Young people are often not aware of the emotional state they're in, of the emotion that they're feeling. They're just in the moment, but they're not really aware of how they are. So the first thing you can do is name it to tame it. So label the emotion for them. If they're feeling angry, say, I see you're feeling angry. And at the same time, validate it. It's okay to feel angry, because it always is. We can't help the way we feel, and your young people can't help the way they feel. Emotions are out of our control. So name the emotion and validate it. Let them know it's okay to feel that way, but help them to respond to it in a more helpful way. Talking is great emotional processing. I'm a therapist, I do talking therapies. I help people process emotions through talking, and you can do the same. So again, I know it takes time, but if you can, create little opportunities in the classroom where you can just talk to your students, where you can share experiences, where they can share how they're feeling if they feel able to. And again, I've already talked about, it would be really ideal if there was a quiet space, supervised space, but a quiet space in your school where young people could go if they're struggling. And the other thing you can do to empower students is encouraging a survivor mindset. Not everybody who experiences a traumatic, life-changing event like COVID will develop PTSD. And in fact, a significant number of people will actually have post-traumatic growth. Rapid times of change can often lead to rapid personal growth, and this can often be quite positive. And so we want to encourage students to move in that way. And one thing you can ask them is, what have they learned about themselves over the past few months? I've certainly learned an awful lot about myself. I've learned more about how I cope and how to look after myself when times are tough. I've also learned a lot about what I value in life, what's important to me. So start those discussions with students, encourage them to think about what they've learned about themselves. Are they surprised actually with how well they've adapted and how well they've coped? There are lots of stories and books about hope and resilience, and again, they can be really useful in the classroom if you can incorporate them into your teaching, particularly for younger students. And just to remember that a survivor is active, whereas a victim is passive. And we want to encourage the survivor mindset. We want to encourage the students to be active. So help them to think about what is within their control. There are so many things at the moment that are outside their control. They can't control the rates of COVID, individually. That's beyond our individual control. They can't control whether the school or college stays open. They can't control whether there'll be a lockdown or not. But there are things, and there will be things for every student that they can control. Can they control how healthily they eat? Can they control how many hours sleep they get? Do they have control over how many hours they might be able to study? Try to encourage them to think about what's within their control, because that will help them to develop motivation and to feel more empowered and avoid that kind of defeated, powerless state, which is associated with distress and mental health, poor mental health. And finally, we're moving on to you guys, you as the teacher, and self-compassion. I kind of put this picture up as a little bit of humour, actually, a little bit of a giggle, because I don't suppose there's many people that have spent the last few months chilling out in hammocks. Certainly I haven't. That wasn't my experience over the past 6 months or so. But self-compassion is really so important right now for you as teachers. when I work with teachers, when I do teacher training workshops, I'll quite often ask them, who is the most important person in the classroom? And very conscientious teachers will say, the students are the most important people. And I always say, no. And I think this is so much more important now in the middle of this global pandemic. You as the teacher, you are the most important person in the classroom, because you are going to be the key for the recovery of your students, both emotionally, where you're going to play a big role. I think teachers always underestimate how important they are to their students. You're going to play a big role in supporting your students, and you're going to play a big role, obviously, in helping them to catch up educationally. Take care of yourself. Think about your needs. Try and prioritize them when you can. Don't be afraid to ask for help. Now is the time to ask for help. We can do this if we work together. Share the workload with your colleagues. Share work, ask for help, ask for support from friends and family. And be kind to yourself. Set realistic expectations. This is tough. We're in the middle of a global pandemic. We are doing the best we can. And as I say, we can do it if we work together. So that is the end of my talk. I've got my sources on my PowerPoint. I think we're now over to a Q&A that Karen is going to introduce.
Thanks very much, Kate. That was hugely insightful and some very clear tips. And I think a lot of the situations you described, I saw that there was a lot of recognition in the chat box for those. There are a lot of questions. I tried to sort of group around themes. One thing that came up a lot was about support for teachers, and you just touched on that. But support for adults, how, so a lot of teachers that have adult learners, and there was a question, how do they support adults?
I don't think it's too different, really. I think, Karen, from certainly the older children, the adolescents that I talked about. I guess, again, communication is going to be so important with your adult students, trying to keep and build that connection with them. And I do think that when you first are back in the classroom with these students, with your adult students as well, spending a bit more time on building relationships, sharing experiences, sharing how people have been, how have they coped, is going to be really helpful. And I know that's time away from tuition, but actually this is about helping people feel safe and secure so that they can go on and learn in your classroom. So I think that's what I would focus on, this focus on relationships, focus on connection, and focus on communication. The signs of distress and trauma that I went through, I'm just thinking back to that, I think are equally applicable to most adults. Again, any change in behavior, change in the way someone's presenting themselves, any of that can indicate an underlying problem. So if you're concerned, start that conversation with them. You know, don't be afraid to do that. It's so important that we're all open and honest and able to be vulnerable with each other at this time, because that's how we're going to be able to support each other.
That sort of links with a couple of other questions which came up about the more reluctant students who don't want to share. And the question, can teachers foster a help-seeking attitude in students?
Oh, that's a good question, a help-seeking attitude. I think here, actually, if teachers are feeling brave enough, this is where self-disclosure can really help. And by self-disclosure, I mean that if you're prepared to talk a little bit about the experiences that you've had over the past few months and about some of the struggles and challenges that you've faced. And this is actually something that I will do in my own sessions with young people and with adults. If I've had a tough time and it's relevant to what that person is struggling with, I often will talk a little bit about them. And that's helpful because you can then role model being open and being able to be vulnerable and talk about psychological problems, mental health problems, talk about struggling with that person in front of you, with that young person in front of you. So you become a positive role model for it. And often, if teachers are able to just open up a little bit with their students, you will find it strengthens the relationship enough that they start to open up to you. It is important never to put a student on the spot though, and to avoid any kind of interrogation. It's more about providing those opportunities for them to talk. Because obviously if we put them on the spot, if we ask too many probing questions, they're going to feel quite threatened, or there's a chance they'll feel quite threatened. So often, I don't know, maybe before classes or after classes, if it's possible, just to have a quick word with a student. Those are often good times to start those conversations.
And another area that's come up is online classes, and a number of people have suggested it's quite difficult to tell in an online environment if somebody has any issues, and how would you identify those online?
Gosh, I think that is a lot harder, particularly if you've got an online class with quite a few people taking part. So it's much harder to monitor body language. You don't get to see the whole student and the way they're presenting themselves. So some of the things we talked about, some of the signs wouldn't be visible. I think in that case, this is where pastoral care becomes really important. And I think it's about designing for schools themselves to design systems and structures where there is somebody who's checking up on that person's well-being, whether that be a tutor or a mentor. Yeah, other than that, it's difficult. Young people sometimes find it easier to respond through messaging. They can find video conversations about mental health sometimes quite threatening. So that's something else you could try, that if you do spot anything that you are worried about a student, and again, I wouldn't hesitate to ask, because if a student is fine, they will tell you they're fine. But if you are at all worried, you might be able to message that student if you're concerned, and they might find it easier to message back rather than in a video format like the one we're on now. But again, I think that's probably more about systems and structures and having a pastoral team that are checking up on the students if you're working purely online.
Yes, and talking of sort of systems in place, a number of teachers suggested their schools weren't terribly supportive, and therefore how could they help teachers given that the school wasn't set up how could they support learners given the school wasn't really set up to provide that help?
You can only do your best. You can only do your best. And I think it's really important that teachers don't try and take on everything, if that makes sense. Of course, I would say, try and talk to your leadership teams. If they're not being supportive, how could they be more supportive? But also don't underestimate some of the simple things that I talked about in my presentation. So don't underestimate the power of listening to students, seeing whether you could make extra time to listen to them, to give them an opportunity to talk to you. Maybe create a group activity where students can share their own experiences together. Don't underestimate the power of that sense of belonging, just the language that you're using. We're in this together. We will get through this together. that can also be very powerful in counteracting that feeling of being on your own. But I think it is important that teachers are realistic and they must put themselves first. So if they're feeling undue stress and pressure, please do look for help and support for you, because you're going to need that to get through the next few months, perhaps the next few years in the light of COVID. Try and look after yourself first.
Thank you very much, Kate. I think that's a very positive note to finish on. And there certainly has been a lot of interest in tips for teachers. So perhaps that's something to follow up on.
Great. Yeah.
So thank you very much for a very insightful, informative talk. And I can see from the chat, it's been hugely appreciated.
Brilliant. My pleasure. My pleasure. Thank you.
Thanks. And thanks everybody for attending.